Greetings and thanks for tuning in again. I'm trying for this for the second time because the first time the audio wasn't working. So hopefully you can hear me now. Today, I wanted to address the issue of waking up with back pain or neck pain. Now, I'm a doctor of physical therapy. My name is Dr. Jeanette DeWitt, and I specialize in medical massage as well as performance coaching. It is very common for me to see neck pain, back pain, headaches, migraines, jaw issues in my office as well as virtually. And one of the biggest complaints that people describe to me is waking up with pain. And when that happens, I often say it might be your sleep position. Why is that? Well, people sleep in all kinds of positions. And one of the worst positions to sleep in is actually on your stomach with your head cocked to the side. When you do that, of course you got to cock your head to the side because you need to be able to breathe. But you are really straining the neck muscles and you are creating a little bit more tension in the low back area, especially if you have already been diagnosed with osteoarthritis or degenerative disc disease or stenosis of the spine. So when somebody sleeps on their stomach, that puts more pressure and makes the space that the spinal nerves come out of smaller, so it can feel a little pinchy or painful when they wake up in the morning. Now, these positions that I'm about to show you aren't the end all or be all, but what I like to say to my clients is that it is a good starting place if you're waking up with a lot of back pain or neck pain, or if you wake up with headaches. So I'm going to show you a few tricks here. First of all, you can take a simple thing like a hand towel and just roll that up, and you're going to create a little bit of a towel roll. And I usually have patients start with this because you can take the pillowcase and you can put that towel roll right into the pillowcase, and it should stay in place throughout the night instead of unraveling. And why I like that is because that towel roll serves as an anchor point for your neck so that you're not cocked to the side or kind of arching back on the pillow or being cocked forward on the pillow, depending on if you're lying on your side or lying on your back. So that towel roll is really, really nice. Once you determine that the towel roll works, then I usually recommend getting something like the 𝗫𝗫𝗀 neck roll, and that can slide in to the pillow as well and stay in place. The reason we start with this, because if this isn't the answer, there's no sense in buying the 𝗫𝗫𝗀 neck roll. But if this does help, the 𝗫𝗫𝗀 neck roll covers the length of the pillow, so it doesn't matter, like if you shift around, you're always going to have neck support within the pillowcase. Now, the next thing I usually recommend is another pillow to put under the legs or between the knees when you're lying down. So first of all, when we get in and out of bed, I recommend sitting on the bed and then lying over onto the side. And you could actually just stay there and put a pillow between the knees. And now you've got this nice neck roll supporting the neck, and you're in a great sleep position while your spine is pretty much neutral or straight. So you're not like cocked to one side or anything like that. If you drop that down, see what happens? My pelvis rotates forward and I start to rotate or twist. Well, a lot of people wake up with back pain because of this position. So when you put that pillow between your knees, it prevents this top leg from falling over and creating that twist or rotation on the spine. Let's say you want to lay on your back. You can roll over onto your back, and then you can fold that pillow in half, and now you have support this way. Or if it's a big enough pillow, you can simply lay it there. But as you can see, this is kind of a flat pillow, so it's not very supportive for my knees. So I like to bend that, and now I'm nice and supported. The reason you want flexed knees is because that allows your back to flatten against the bed. And when that happens, your back is more supported and it takes the tension off of the spine. When you go to stand or get up out of bed, I recommend rolling to the side and then using your hands to support yourself. I usually ask my clients to sit on the edge of the bed for a little bit. You've been lying flat for 7 to 9 hours if you're getting the appropriate recommended sleep for adults. And sometimes your blood pressure can change a little bit. You can feel a little dizzy. So I usually just recommend sit there for a little bit, let things settle. Gravity has been off of your spine and the discs of your spine for overnight. So letting gravity kind of gradually come onto the body is a good idea. And then coming forward and getting up. So that is really what I recommend when people are waking up with neck pain or back pain, using the neck roll, whether you start with the towel or you get the McKenzie neck roll, and then using the pillow underneath the knees or between the knees. These are a great way to help support your spine while you are resting and repairing all the work you've done through the course of a day. I hope you find this helpful. If you have any questions, please go ahead and message me. You can also reach out to me if you would like to sign up for more of these tips through my Stronger Every Season newsletter that comes out every Tuesday. Thanks a lot and have a great day.